Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Monitoring, Evaluating, and Applying Findings brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute strategies to monitor and evaluate implementation efforts and interventions, strategies to collect and analyze data for a variety of evaluation types, and then using data to make decisions and plan for sustainability of programs where feasible. It does this by providing step-by-step guidance to strategize and develop a plan for evaluation, collect and analyze data and consider fidelity and costs, and then use results to make decisions about ongoing efforts and sustainability. The Monitoring, Evaluating, and Applying Findings brief is broken down into 4 parts and 11 essential functions or tasks. It's important to remember that while the steps are presented in a linear way, in practice, often these steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. Part 1 is setting the stage, and includes considering the circumstances and needs of the agency, developing a logic model, identifying questions, and identifying the data measures, sources, and collection methods that will answer them, and then developing an evaluation plan. Part 2 is collect and analyze data, and it includes strategies to put the evaluation plan into place by collecting and analyzing the data outlined, and then 2 special featured topics that are a version of data collection and analysis. They are examining fidelity, which is the topic of this module, and analyzing costs. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, and then making decisions to further spread, adjust, or discontinue. And Part 4 is on sustainability planning, and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's get started. Why do teams examine fidelity as part of collecting and analyzing data? The primary objective of a fidelity assessment is to measure whether staff are delivering the intervention's core components as designed or intended. Fidelity assessments can help teams ensure that a selected intervention is being implemented as designed, identify needs for training, coaching, practice guidelines, or other implementation supports, and bring attention to system barriers that need to be addressed, for example, policies that don't support new practices. Fidelity assessment is an essential part of an effective change and implementation process, and can overlap with, as well as inform, both formative and summative evaluations. Including fidelity measures in an implementation plan can inform teams about why an intervention is effective. It is important to determine the extent to which and how well the intervention's core components were implemented. Were the components implemented as intended and consistently across all sites? How well the intervention and theory of change matched the intended target population, and whether the intervention was given enough time and that it was delivered in the right amount or dosage to make an impact. If outcomes are not achieved, fidelity assessments can shed light on whether it was due to the intervention not being implemented as intended, for example, not following the program model or insufficient dosage, or other reasons, for example, a poor theory of change or a change in the needs of the target population. Fidelity assessments generally measure 2 types of information: the extent to which the intervention's core components are delivered as intended, sometimes referred to as adherence, for example, determining whether staff are doing the expected behaviors, and the quality with which the core components are delivered, sometimes referred to as competence, for example, determining how closely the behavior standards were met. How do teams examine fidelity? The first step is for teams to identify fidelity measures and assessment procedures. Teams that implement an established evidence-supported intervention may find that a fidelity assessment protocol already exists, which can be used as is. or adjusted to fit the new context. Teams that have designed a new intervention or substantially modified core components will need to develop a new assessment. The starting point for creating a fidelity assessment is to look at the intervention's program manual, practice profiles, or other detailed guidance that describe expected behaviors and competencies, and then identifying measures that show whether they are being conducted as intended. Teams also will need to consider how measures will be assessed and whether specific thresholds for achieving each measure will be set. For example, what measures or behaviors will tell the team how closely the intervention was followed, and what measures will tell the team whether these behaviors were met. Questions that can guide this process are: what are the core activities of the new intervention? How will the team track and measure fidelity and outcome changes across different sites? And what does competency in the new intervention look like? Next, teams should identify possible data sources for each area they want to measure fidelity for. Sources may include case records or documents, information management systems, structured observations or assessments, or surveys and interviews with staff or service recipients and other sources. After identifying measures, teams will need to adapt or develop related tools and processes for implementing the fidelity assessment and collecting related data. By developing and communicating a practical, uniform approach, teams can encourage consistency in its application. As teams develop fidelity tools and procedures, they should consider how they plan to use fidelity results, the desired frequency of conducting the fidelity assessment, whether all staff or cases will be reviewed or just a sample, who will be responsible for conducting the fidelity assessments, for example, independent observers, CQI staff, program managers, or supervisors, and how will the individuals assessing fidelity be trained, and how will consistency be ensured? How data should be collected, aggregated, stored, and maintained, and how confidentiality will be protected. And how will fidelity assessment findings and recommendations be shared, for example, with supervisors and coaches for developmental purposes, and in aggregate form for wider distribution? Teams will need to weigh their desire for the best information with what is reasonably feasible within their system, and the development of fidelity tools can be supported by either internal or external data collection specialists or program developers. Agencies should collect and monitor fidelity data over time to support ongoing monitoring and continuous improvement efforts. And it's important for teams to approach fidelity not as a tool to gauge performance compliance, but a tool to develop and improve the agency's ability to implement effectively. Assessing fidelity and making adjustments is particularly important in early implementation to determine areas needing attention. And after implementation, when practice inconsistencies are identified, to determine what adjustments are needed to improve adherence and competency. Fidelity assessments over time can prevent program drift and can help teams understand why anticipated outcomes are not occurring. Teams can then further analyze fidelity data to understand whether the intervention is being implemented as intended and consistently across sites, to recognize strengths that they can build from, to identify areas needing improvement and assess underlying causes for a lack of fidelity. For example, is it a lack of the needed knowledge or skills among service providers or worker overload? To develop plans for strengthening implementation supports, for example, training, coaching, additional practice guidance, or other supports. And to recognize organizational barriers or system issues getting in the way of implementation. For example, a mismatch between practice guidelines and policy requirements or performance rewards, and then brainstorm solutions to address these. It's also critical for teams to recognize that fidelity assessments should not be used for punitive purposes or to single out individuals with performance issues. Doing so can discourage staff from trying new approaches and applying new skills or from providing true data. To examine fidelity thoroughly, teams should use a range of sources to understand how their intervention is being implemented and whether there are improvements needed, and they should consider the following questions as a group. To what extent do the fidelity assessment findings suggest the intervention is being implemented as intended? Are there one or more components not being implemented as intended? If not, what are the reasons why? Is there consistency across implementation sites? If not, what supports might help improve this? What are possible barriers to fidelity? What steps can the team take to remove these barriers or make them more compatible? What implementation supports should be put in place or adapted to improve fidelity? Taking the time to answer these questions together as a team will help teams have a better understanding of how fidelity to their intervention is impacting implementation. Let's take a look at an example from the brief. This is an example of the kind of fidelity measure that teams developing a fidelity assessment for an in-home visiting program might look at, and the potential sources. Teams should begin with the core component. In this example, the core component is make connections to needed services. Next, teams would look at the expected behaviors, which in the example might include the action of providing the referrals to community services. In addition to tracking tangible actions, for example, the completion of assessments, fidelity assessments may also explore intangibles reflected in the core components. For example, in an in-home visitor program, fidelity assessments should pay attention to the dynamic relationships between the services provided and client needs. From those barriers, teams need to consider how they would measure them. The measures in this example might include assessment of family needs, the number of referrals made, and the type of services received. And then identify the sources of data for each measure. In the in-home visiting example, it might include case files or parent interviews. To make a fidelity assessment practical, teams may need to prioritize measures and sources. Measures are not necessary for every behavior associated with every core component, but the fidelity assessment should reflect the most relevant and critical program aspects. Teams should also circulate the list of fidelity measures for review and feedback among team members, frontline staff, and other practitioners who will deliver the intervention, as well as other program stakeholders. Let's take a moment to check in on what you've learned about examining fidelity. Why do teams need to examine fidelity? Teams examine fidelity to ensure that the selected intervention is being implemented as designed, to identify needs for implementation supports, and to bring attention to any barriers that need to be addressed. How do teams examine fidelity? By identifying fidelity measures from other sources or developing new fidelity measures, developing the tools and protocols, and then using data to make improvements. What helps teams examine fidelity? Teams should use information from a range of sources to help understand how their intervention is being implemented, to identify consistency and barriers, what supports may be needed, and whether the findings suggest improvements are needed. Now take this a step further by reviewing the reflection questions for Examine Fidelity in your Monitoring, Evaluating, and Applying Findings workbook to connect what you've learned to your own experience. Up next is Analyze Costs, the 9th module in this series, and the second special topic under Analyze Data.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.